Aloha. Good morning and welcome to Hawaii Care Choices Healthcare Talk Story. I'm Tish Lopez, your moderator this morning. Thank you so much for joining us on this beautiful Aloha Thursday, or as I like to say, Friday Eve. Before we dive right in, we want to let you know that today's Zoom meeting is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. For those of you joining us on Zoom webinar, the bottom of your screen should look like this. Please click on the chat box and say aloha to everyone here and let us know where you're joining in from. Healthcare Talk Story is now an interactive presentation. We will be asking you questions throughout the presentation, so please use the raise your hand button to send us feedback. And lastly, please click on the Q&A box at any time to submit your questions to our panelists. To those of you watching it on Facebook Live, thank you so much for joining us and aloha. Please use your comment box to say aloha and let us know where you're joining in from. Feel free to chat in questions as well as share your reactions with us during our talk story. We love to see the hearts, thumbs up, and even the care button. Again, the talk story is an interactive presentation and we want you to join in with us. Use that comment box and put your answers right on in there. We are also doing polls today. For those of you watching on Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you. Feel free to put your answers right there in the comment box again. Everyone is welcome to join in on the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I'll send you the link. So polling is very simple. A question will pop up on your screen, similar to what you see here. Please make the selection you think is best and submit your poll using the bottom button there. Just to kick things off and make you comfortable, let's start with an icebreaker. All right, question on your screen is if you could be one of these mythical animals, which one would you be? A dragon, a unicorn, a mermaid, or a sphinx? Again, those of you on Facebook Live, please let us know in the comment box if you would rather be a dragon, unicorn, mermaid, or sphinx. All right, I'm going to go ahead and the polling right there, and I'm going to share the results. So 25% of you said dragon, 50% said unicorn, and the other 25% said mermaid, 0% said sphinx. That was super easy. Everyone's up and had their coffee. Thank you so much for joining in on our polls. We will get to more of those later on in the presentation. Now I'd like to introduce to you our speakers today. We have Lonnie Weigert, Community Relations Manager for Hawaii Care Choices, and our wonderful presenter on all of our presentations. If any one of you on Facebook or Zoom have heard Lonnie speak before, please send her a comment or a chat and say hello or give her some hearts. Aloha, Lonnie.
Aloha and aloha, my friends. Thanks so much for joining us again.
This morning, we have three special guests joining us. Ali Park, President of Clinical Labs of Hawaii. Aloha and welcome, Ali.
Hi, sorry.
No worries. We also have Michele Cox, Chief Operations Officer for Clinical Labs Hawaii as well. Aloha and welcome, Michele.
Aloha.
Our third guest this morning is Dr. Scott Miscovich, President and Founder of Premier Medical Group Hawaii. We will be welcoming Dr. Miscovich later on in our presentation. So today on Healthcare Talk Story, we will talk with Ali and Michele, who will give us the inside details at Clinical Labs Hawaii. Then we'll hear from Lonnie Weigert as she explains the 11 reasons why palliative care can help. And last but certainly not least, we will talk stories with Dr. Miscovich and discuss about Premier Medical Group and hear his insights and forecasts on living with COVID. I am so excited for all of you to join us right here on our Healthcare Talk Story. Friends, if you can please give me a warm virtual welcome to Ali Park, again, President of Clinical Labs Hawaii since 2007. She was born and raised in Hilo, and Ali understands the importance of community. Together with Michele Cox from Kailua, is the Chief Operating Officer since 2005. They have carried on the family business, but more importantly, they carry on the focus and vision that Clinical Labs Hawaii takes care of everyone's specimen as if they are family. Thank you, ladies, so much for joining us this morning.
Hi.
Thank you for having us.
I'd like to start by asking Ali, can you please share how clinical labs got started and when did you open the Hilo clinics?
Okay, so my dad was originally from Korea, and he trained at the Mayo Clinic, which is actually where I was born, in Rochester, Minnesota. And a year in, he and my mother decided they needed to be somewhere much warmer. So a job came up in Hilo, Hawaii, and so we moved to Hilo in early 1971. And he started at Hilo Hospital as only one of two pathologists, and then he started, at the time it was called Hilo Medical Laboratory, and they only had one employee, him and one employee. And so that was the beginning of Clinical Laboratories of Hawaii. So it actually started between, my brother was born in Hilo in 1971, so it's actually like my second sibling. So Clinical Labs is my sister. So anyway, so yeah, we've been in operation. This will be 51 years this year. And his desire at the time that he came to Hilo was they were still using World War II medical laboratory techniques in 1970. So he really wanted to modernize medicine in Hawaii, particularly on the Big Island. So within 10 years, he had developed clinical labs throughout the island of Hawaii. And one of the really cute stories that we have about him is that he used to travel on alternate days to like Kau and Hamakua. And he was down in the Kau lab, and one of the doctors came in, and he was really kind of mad at my dad. And he said, "You guys messed up this lab result that I had. I drew a patient this morning, and I already have the results, so I know you put it into the computer wrong." And my dad's like, "Yeah, I know. The sample used to take like a week because you used to have to send it to Honolulu to get it done, and then it would come back." But he said, "Nope, we've improved the medicine so much that we drew the sample this morning, and we now at 1 p.m. have the result back for you." So that's how he changed medicine on the Big Island. Yeah. So the doctors could actually treat their patients at the appropriate time in the appropriate place. So yeah, so he grew the business from one location in Hilo and one employee to what we have now, which is like 60 locations plus, depending on the day, and over 850 employees.
Wow, I mean, that is such growth over those years. And it's just so nice to hear that Clinical Lab started just from these humble beginnings. So, and I'm sure everyone nowadays are just thanking your dad so much that he has revolutionized the way that we receive tests now. And I'm sure they were just so excited way back then as well. That is such a great story. Thank you so much for sharing that. I have a question for Michele. Can you please give us an idea of how many patients you serve in Hilo and how many tests are run on a daily basis, just to give us an idea of the scope of volume that goes through your labs here?
I'm going to say for as long as we've been on Hawaii Island and in Hilo, we probably serve the majority of the patients, if not everybody. We probably perform over 1 million tests a year for the Big Island. We support 13 locations and the 4 hospitals on Hawaii Island. So really the vast majority of the specimens come probably to Clinical Labs of Hawaii.
Wow, that is really amazing. And now we've known, I mean, we can just get our lab results so quickly. What are the, yes, what are the biggest challenges, Michele, that you have for your labs?
Biggest challenge now, especially going through the last 2 years of the pandemic, is staffing. We're very lucky, on the Big Island, on Hawaii Island, throughout the state. I'll say we have the best employees, so they're very dedicated. Like every other industry, we've struggled to support just the volume coming through recently. But our employees have gone above and beyond in working overtime, in giving up their time off. So it really is staffing. It's nice to see that people who were never involved in healthcare are actually now interested in it. You know, we hear a lot of stories about people leaving the medical industry because of the pandemic. Here at Clinical Labs, we have a surprising number coming in because they now have learned about the laboratory, what we do, the science, and they're just very interested. So we have people applying to become laboratory assistants and medical technologists, and we want to encourage that. We really want to encourage, you know, our kids to come back home, and we want to home grow them. The medical technologists, that occupation, there's a huge shortage nationwide. And so the more of our kids that come home and go into that industry, the stronger we'll be as a medical industry in Hawaii.
Wow, that is awesome. And yes, definitely want a lot of people to come back home here in Hawaii. Mentioning the pandemic, Ali, how has things changed for your lab since the pandemic, especially with the COVID testing? I mean, I know Michele touched on it a little bit as far as employees and things, but are there any other big things?
Well, I think before COVID, the lab was sort of like a submarine. We sort of moved under the water and people weren't as aware of us. I mean, healthcare professionals knew what the lab did, but suddenly it was on CNN every night about what the lab does, how lab tests work, how the blood tests. I mean, we went from anonymity to like full on front of the public, you know, full facing, and everybody had an opinion, you know. That was a little scary, you know, and also wonderful in a way, because they really acknowledge all the hard work that goes behind the scenes to make sure that people are healthy, and all the, you know, all the exposure that the employees have, the care and the dedication. So yeah, there were positives and there were negatives, and I think the public finally understood the real impact that laboratory has on their lives.
Absolutely. I mean, I seen that, you know, firsthand. Hawaii Care Choices are thankful for clinical labs. I know that. A question for Michele comes from our audience. Are there services for individuals who are unable to leave their place of residence?
So right now, Clinical Labs, we don't provide home draw services, but we do work with organizations that do. If you need help, they're happy to reach out to us, and we can try to put them in touch with those individuals. We know it's a hard time, it's a scary time, and you know, the majority of our patients are able to come into our patient service centers, but if there's something special that they need, we can try to see what we can do.
Okay, wonderful. That is great information to know. Thank you. Lonnie, I'd like to ask, do you have any questions for Michele or Ali?
Yes, in fact, a few questions have come in, and so I'd love to ask. First, Ali, I love that story about your dad down in Ka'u. You know, it's so funny because Ka'u is just a special place in itself. And so just the way people talk and think out there is just, it's so fabulous that your dad went out there and really shook it up for them out there in Ka'u. That is amazing. And then Michele, I actually grew up in Kailua. So you know, I love it. I miss it. It looks a bit different now than it did back in the day, but you know, it's still quite a beautiful place to live. So both of you folks have best of both worlds for sure. So the first question I have is for Michele. Can you please tell us about the antibody response test and why it was created, and how do people get it?
So there's actually two tests that we offer. There's the anti-spike protein test, and there's the anti-nucleocapsid test. The spike protein test is the antibody test that you want to detect your body's response to the COVID vaccine. So that's one test. And for either test, you would just need to go to your doctor and come in with a doctor's order. The other test is the anti-nucleocapsid test, and that test will detect your body's response if you've been exposed to SARS-CoV-2, the actual virus that causes COVID-19. So there are two tests. their blood tests. You just need to come into a clinical lab's location with the doctor's order, and we'll run the test for you. And the best advice is, once you have your results, to visit your doctor for them to review it with you. Basically, it's telling you what your body's response is to either the vaccine or exposure the virus that causes COVID.
Thank you, Michele. Ali, can you share a little bit about how popular these two tests have been? You know, is the community extremely curious on whether or not they, you know, their response to the vaccine is working, or is this more of a hit and miss kind of thing where doctors send the order in for their patients?
Yeah, I've heard of a couple people who are extremely interested in certain instances, like where their entire family gets COVID, but they don't. So their doctor's like, let's check this out and see where your antibodies are. But for the most part, I think because there aren't official ranges that definitely say I am protected, it's different for individual to individual, that they're not as useful of a test as you would think they would be. Yeah, like when you get tested for Hep B or something, you have definite immunities to the disease depending on whether or not you react. But COVID isn't the same way. You could have really high numbers of protein and it still may not protect you from Omicron. It just depends on the individual.
Wow.
So I would say yes. Yeah, it's less useful. It's more of a curiosity more than anything.
More of a curiosity. Wow, that's amazing. Okay. This next one is also for you, Ali. Now that people have access to the COVID home tests, are there any safety precautions to using them?
Actually, I've heard of a couple cases where people didn't read the direction and exposed themselves to the liquid in the vials. I was like, yeah, if you're using an unknown product, you need to read the directions. I've heard a lot of calls into the poison control. I'm assuming they didn't drink the liquid in the vials, but apparently dipped the swab in and then put it into their nose. So yeah, you just have to be really careful about those things.
Okay. All right. Well, that's definitely a good tip. Yeah. We won't let the kids run around with it, you know, so that they're like, oh, let's drink it, mommy. It's like, okay, no. That's great to know. Can you tell us what's the best way to get the most accurate results from these home tests?
I'm not as familiar with the home tests because we don't distribute them and we don't use them. But by nature, they're not very accurate. Some are more accurate than others. It just depends which ones you get. Dr. Miscovich might be able to speak to that more than I could.
Okay.
Yeah, and they need to follow the directions, as Ali said. Read it completely before you start, and know that those kits are temperature sensitive. So right now it's cool in Hawaii, so you might keep it in your car, but it shouldn't be kept in your car. They're temperature sensitive, so they need to be kept in a cool location, not necessarily in the refrigerator. But if you're going to leave it in your trunk and try to use it, that may impact your results. So, you know, the result is only as good as the specimen received and process followed.
Oh, that's a good tip.
Yeah.
That's a really good tip. You know, from the results, that is strictly for home reference, right? Like people can't take that and go on safe travels and, you know, show to go to Vegas or anything like that, right?
No, I believe for the safe travels, I think for many schools or workplaces, they do require a result from a licensed laboratory. So, you know, somebody like clinical labs. Yeah, I think the home test, you know, it's good to know. As Ali said, it's most definitive if you're symptomatic, but, you know, if you don't feel well and you took a test and it's negative, you may want to follow up with your doctor and get a laboratory test.
Okay, thank you so much, Michele. I see that we got another question that came in from the audience. I'll turn it over to you, Tish.
Yes, we do. And it is a great question. And it's actually regarding test results. So I'm not too sure if Ali or Michele want to answer or both. But this person is asking if you can please explain and talk about a little bit of the false positives and the false negatives that come with the test results. How does that happen? Why does it happen?
Okay, I'll grab it. So as Ali said, the laboratory has always been, quiet. She said, I think she called us the submarine. And I think for all this time, people didn't know that tests are not necessarily 100%. It's 95, 96, 97, but there's always a small chance of error. And as I said, there's so many factors that go into the laboratory test, from specimen collection to processing, to loading it onto the analyzer. We run quality control every day in the laboratory on every instrument. We do a lot of quality checks. But if the specimen collected is weak or the process was not followed, you might get a false negative or a false positive. So knowing that it's not 100%, testing today is much better than it was when COVID, SARS-CoV-2 came out in 2020. There's so much more known. But again, if you're symptomatic and you get a negative, you want to question it and you run an antigen test, you are going to want a PCR test or a NAT test. False negatives and false positives do happen, but they should not happen often. Here in the laboratory, we actually pride ourselves on being very OCD, quality on top quality on top quality. So if we feel that something's erroneous, we will repeat and we'll do all follow-up necessary. So, that's the difference when you come to a accredited laboratory, is there are standards in place and we are regulated. But, the antigen tests on the market, they are good. You just need to understand when to use them and then when to go with your gut and go see a doctor. I'm sure Dr. Miscovich can talk about that a little bit more, but there's a reason you go to the doctor, right? He's going to be he or she is going to be the most knowledgeable and guide you to what you need. And that's really what you want.
Okay, wonderful. Thank you so much for explaining that. Ali, is there anything you wanted to add for the test results question?
No, not that I can. I was thinking of something, and then I'm sorry, I've lost the train of thought.
It happens to the best of us, I assure you. Yes. Oh my goodness. All right. Well, that is all the questions that I have. I just want to say thank you so much for sharing all of this great information. It is so nice to see the behind the scenes, if you will, sneak peek of what's happening over at Clinical Labs Hawaii, where I have to say I personally had my blood drawn. I'm sure Lonnie has, my children have multiple times, even had, the COVID testing there as well. And I always do have this feeling of family when you're there. So it's so nice. And we are so happy that you guys are in our community. And to know that this large clinical labs came from such a humble beginning. So thank you so much for sharing that story. Are there any last comments, Ali, that you have, or would you like to say to our guests?
Just that we're very grateful to our patients and our supporters in Hawaii. Being a local girl myself, it warms my heart that, we can be there to take care of the community. And I think we were tested by fire during COVID, and I feel like we emerged, and I think the community now recognizes that we really are an important part of the entire healthcare process. So that was.
Absolutely. Yes, I agree with you as well. Michele, is there any last comments you'd like to say to our guest?
Yes, as Ali said, thank you very much to the Hawaii Island community. We've been there since day one, and thank you for the support, the patients. I could not be more proud being a local girl of the state of Hawaii. Back in 2020, when it was such an unknown, we had the lowest positive rate, and that was a direct result of the medical community and everybody just coming together and taking care of each other. And then a big shout out to our employees. You know, not everybody gets seen. Our couriers, our lab assistants, medical technologists, all our support staff have worked tirelessly, so very hard through every surge. You know, there's a surge and then we go, okay, we're good, we're through this. And then boom, there's another surge. And, you know, it's like Groundhog's Day every day. But big shout out to our employees, big mahalo. Yeah, we got through this because of them, and really so proud of Hawaii in general.
Wonderful. Lonnie, is there any last words you'd like to say to our guest?
Yes, I will. I actually just want to thank you folks so much. At Hawaii Care Choices, we could not have gotten through as far as we did without the backing of the employees that you have, boots on the ground right here in Hilo. I mean, they really backed us up, and we were able to get not only tests for our patients, but all of our employees as well. And you folks, just the idea of Clinical Labs of Hawaii just floated to the top when it came to having guests come on to talk story. And it's such a tremendous honor to have both of you come on together, because we really owe you such a huge amount of gratitude for the wonderful services that you provided for us, Hawaii Care Choices, as well as our community at large. So thank you again. Thank you so much for your time today and joining us. This was so interesting. Thank you.
I agree. I second everything Lonnie says, and we are just tremendously happy for you guys to be here. We don't want to take any more of your time. We know you guys are so busy today, but I just want to say a big warm mahalo, Ali and Michele, for joining us this morning. And I hope you both have a beautiful day.
Thank
Aloha.
you. Thank you. Aloha.
All right, friends, let's move right along. Our presenter our next presenter is Lonnie Weigert. I know we had a quick talk story with Clinical Labs, and that was just such great information. I didn't know that they came from such humble beginnings, so it's so nice to hear it from Ali herself. That was really, really amazing. So without further ado, if you could please give a warm virtual round of applause for Lonnie Weigert as she tells us the 11 reasons why palliative care can help.
Aloha, everyone. Thank you so much. Wasn't that so interesting? Oh, we love going backstage and just pulling the curtain back and letting all of us come in there and ask all of these kinds of questions. It is just so enjoyable. And also it's quite humbling to know that these professionals are right there in our community, and we have no idea of the great work that they are doing. So that was such a treat for all of us. So let's start. Let's get this all unpacked. Let me share with you about the reasons why palliative care can help. So I'm talking about palliative care in direct relationship to anyone who is dealing with a serious illness. So the focus on palliative care is really about providing relief. So palliative care is about easing, alleviating, soothing the symptoms that normally happen with serious illness because of treatments that people are having. But the base reason palliative care was created was to really boost the quality of life.
So friends, I want to just remind you, we are now entering into the interactive part of our Zoom presentation. So as a friendly reminder for those on Zoom, use the raise your hand button or the chat feature. And of course, if you have any questions, please click the Q&A button down below for Lonnie. So we're going to start off, raise your hand if you think palliative care improves the quality of life for patients and their families.
Thank you so much, Tish. And I want to say that the reason palliative care is so unique in itself is because it doesn't only focus on supporting and caring for the patient, but it also really helps the family and caregiver as well. So that is one of the top reasons many people will sign up for this. The other thing is people, aren't really sure what is serious illness. So the illnesses that I put right up here, cancer, CHF, COPD, and kidney failure, those are specifically the ones that we are targeting, but there are so many more. It's just that on this particular program, these are the ones that we are focusing on. And what happens is that serious illness really is something that when it's measured, there could be a much higher risk of death if not managed properly. And also we tend to start to lose or have negative impacts on our activities of daily living. And it's largely because of the symptoms that are really impacting our lives. And what is a really big point here is that the caregivers normally have to deal with a lot more stress, and there's so much more strain on them over time. And so this is when we know the illness is indeed serious.
So type yes in the chat box or the comment box if you know someone that could benefit from palliative care.
So the convenience of having palliative care. So if anybody signs up for palliative care, at home is where they're going to receive their care. And, with the pandemic, when it started in March 2020, it was amazing, how many people were receiving their care at home. But that doubled, if not tripled, once the pandemic came. And people realized how convenient and how much safer they felt when we came to their home to provide the service. And that's where we provide our care, is always at someone's home.
Raise your hand if you would like this type of service for yourself or your loved one.
So there are some similarities about palliative care and hospice care. So one of the things I need you to know is that hospice care is actually a subset of palliative care. It's palliative care at the highest level. So what is similar about both of them? Normally, palliative care, people will come to us further upstream in their illness. And what we found is that both hospice care and palliative care relieve suffering. They both can be delivered at home. They both improve the quality of life, not only for the patient, but for the caregiver and the family as well. And they both create a plan of care, also known as goals of care.
Type yes in that chat box or comment box if you understand how hospice and palliative care are the same. All right, and there is our brain teaser bell. I'm going to go ahead and launch one of our brain teasers up on the screen now. How is palliative and hospice care the same? Both relieve suffering, both can be delivered in patients' homes, both improves the quality of life for patients and their families, both create a plan of care, or all of the above. For those of you watching on Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you. Feel free to put your answers right there in the comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me at lopez@hawaiicarechoices.org and I'll send you the link. All right, so looks like everyone has put in their answers. I'm going to go ahead and end the poll and share the results. So 100% of you said all of the above. Thank you so much for joining in on our polls. Back to you, Lonnie.
Thank you, everyone. Oh, that was 100%. Everybody got that right. So the other thing about palliative care that's really nice is oftentimes when there's a serious illness, people feel totally out of control on, there's no way that I have any control on my life now. Everything is just so sporadic. But actually, when you have palliative care, you are totally in the driver's seat. And that's what's so beautiful. And the reason is because when we come to your home, we're actually going to find out first and foremost your values, your priorities, and your goals. And that's how we create the goals of care plan. And so it's important when our team comes over to your home and asks you these questions, because the patient is always going to be at the center of everything that we do.
Raise your hand if you or anyone you know would like to take control of their care.
So bottom line, palliative care really helps reduce pain, and pain that is normally directly associated with whatever the serious illness the patient is dealing with, but also from the symptoms of the treatments that a person is getting. So we will come in and help to manage all of the pain medication, and we will provide education on how not only the patient, but the family can help manage all the symptoms and the way that they need to live going forward.
Would you like this type of care delivered to you right in your home? Type yes or no in the comment or chat box.
So, like I was saying, palliative care is so wonderful because it's not only going to focus on the care for the patient, but it's really going to help the caregiver and the family. So if you know of anyone where you notice the caregiver is getting kind of frail or tends to be sickly as well, they probably need that support at home. And do not hesitate to call us directly because we will come out to help. The key thing is that the earlier that somebody calls, the more support that we can provide at the right time. And that's important, to have the right care at the right time. And so go ahead and call us so we can help educate and help people manage their disease at home with their entire family.
For those with serious illness, signing up early could ensure quality of life for patients and their caregivers. Again, we want to hear from you. Type true or false in that chat or comment box.
So palliative care definitely relieves stress. And the reason why is that you start to realize that there's certain things that you can do at home to help manage that stress, but also you have a team that surrounds you. So things that you want to, or you don't understand, you can ask, and that you have regular visits. So you wouldn't have to wait, once a year to go see your regular doctor. We would work in collaboration with your doctor to make sure that all the care that you need is right there in your home.
If you think these additional services increase the value of palliative care, please raise your hand. Or even send us those hearts.
So a lot of times when somebody is diagnosed with a serious illness, there isn't a lot of time placed on educating them on really how to understand what is going to happen because of this illness. And what is great is having a palliative care team that will be there walking beside you, really updating and educating not only the patient, but the family as well on really what to expect on the journey ahead. And so again, the wishes, the values, the goals of the patient are always first and foremost upfront, so we can be sure to care and serve the patient exactly as they wish.
Is it helpful to understand about your illness or your loved one's illness? Please type yes or no in the chat or comment box. All right, there is our brain teaser bell again. I'm going to go ahead and launch this question on your screen now. Early patient sign up ensures more support and quality of life for all. True or false? Again, for those of you watching on Facebook Live, you will not see the polls pop up, but we want to hear from you. Do you think early patient sign up ensures more support and quality of life for all? Please put that in the comment box down below. Everyone is welcome to join in the fully engaged Zoom presentation next month by emailing me or visiting our website, hawaiicarechoices.org/healthcare talk story. Okay, so I'm going to go ahead and end the poll right there and share the results. 100% of you said true. Again, thank you so much for putting in your answers. I'm going to go ahead back to you, Lonnie.
Thank you, Tish. That was awesome. Okay, so in palliative care, another important aspect of it is our team makes sure that the patient does have an advanced healthcare directive. So for some of you who either might not be familiar with that or haven't had a chance to get yours yet, first, I want you to know that this is probably the greatest gift that costs nothing to you to give to your family. And it happens because if something serious happens and the patient is unable to speak for themselves, this directive becomes the directions for the family to follow. And I have seen firsthand what happens when there isn't an advanced healthcare directive and how the families are in total turmoil because mom or dad no longer can speak and everybody in the family is deciding on their behalf what they would want. But with a directive, there is no problem. There's peace in the family, and we're making sure that mom's wishes are in fact fulfilled.
Right. We want to know if you have an advanced healthcare directive. Type yes or no in the chat or comment box.
So here is our great, wonderful friends at Community First who actually provide advanced healthcare directives. If for some reason your loved one is not on one of our programs, I highly recommend contacting these ladies here, Annie Michele and Sean Saito, right there. Call them, or even, use the QR code or go online and sign up, because having this kind of information is really great. And I tell you, after just one presentation, you will walk out of there with a advanced healthcare directive. So it is really worth the time to go in and find out why having an advanced healthcare directive is so important. And Community First does it right all the time.
Friends, I'm going to go ahead and put that link in the chat for your convenience. All right, there's another brain teaser. Let's see, I'm going to go ahead and launch. Where do I get my free advanced healthcare directive completed or updated? Register online, calling, or all of the above. Again, for those of you on Facebook Live, you will not be able to see the polls pop up, but we want to hear from you. Feel free to type your answers right there in the comment box. You could also email me to join the fully engaged Zoom presentation or visit our website, hawaiicarechoices.org, to sign up. All right, I'm going to go ahead and the polling right there and share the results. 100% of you said all of the above. Thank you so much. Back to you, Lonnie.
We have such a super group today. You folks are just right on top of it. The other reason for palliative care is care coordination. And why that's important is because most of the time when somebody is dealing with a serious illness, they're seeing more than their primary care physician. They're seeing a cardiologist and some other ologists. And before you know it, it starts to become very overwhelming on just trying to organize and coordinate all the doctor visits, the medications, all of that. And so our care team comes in to make sure that all of that is taken care of to really support the patient and the family as well.
Right. Raise your hand if you think you would like care coordination for yourself or your loved one.
So when intentioned regular care happens at home for a patient or a loved one, a lot of the incidents or crises are alleviated. And so, we're not finding ourselves going up to the emergency room or going to urgent care or really going to see our doctor a whole lot more. And it's because all the care is provided at home. And so there's just less need to go to the hospital because there are less crises.
Right. Type care in the chat box if you would like extra care at home for you or your loved one.
And as part of palliative care, sometimes the pain of the diagnosis, the illness, as well as from the treatments could become out of control at home. And when we can't manage those things at home, then people will come to our inpatient facility called Pohaima Lama Care Center. Some of you may know of it, but for those of you who do not, it is really the Mauna Lani of hospice. It is such a beautiful, beautiful facility. And people will come there to manage their symptoms, and go home. For those who are actively dying, they'll probably pass there at this beautiful facility. This is not a long-term care facility or a nursing home. People come here specifically to manage their symptoms, and once that's done, they go home. So if they need to stay overnight, that room and board is either covered by Medicaid or other insurances as well. And people also private pay to stay here overnight.
Lonnie, I think your dogs are so excited about Po'ai Malama as well. And I am too. Please enjoy this short virtual tour of Po'ai Malama.
Welcome to Hawaii Care Choices Po'ai Malama, a Harry and Jeanette Weinberg Care Center. This is a state-of-the-art short-term care facility designed to feel like the most beautiful home you've ever been in. A spacious living room to gather your entire ohana together. The meditation room provides a beautiful space overlooking the gardens to find solace and quiet contemplation. Nothing feels more like home than gathering the family for dinner around the TV, which you can do in the family room while the keiki play in the room next door. Each suite is designed for maximum patient and visitor comfort with sleeping areas for guests, private bathroom facilities, and each room even comes with its own private lanai overlooking the lawn and gardens. When you or your loved one are in our care and you need some extra care, there's no place like Po'ai Malama. For more information, call us at 808-969-1733 or visit us online at hawaiicarechoices.org.
That was so wonderful. It is that beautiful. It really is. So again, back to another reason why palliative care can help. For people who are in palliative care, as their disease journey continues and they progress and need a higher level of care, they're already with us. And so a different team comes in to provide hospice care. But remember, I was saying to you that hospice care is a subset of palliative care. It's just the highest level of palliative care anyone could receive. So it's definitely the Cadillac of all services. What happens is once somebody transitions to hospice care, they no longer are seeking curative treatments. They're not doing chemotherapy or doing dialysis or anything like that. The main priority for them is really comfort. And so that's what they're seeking. Their whole focus changes. It's all about doing things that bring them joy. It's all about spending time with their loved ones. And really their priorities change overall. And in order to have this higher level of care is a 6-month life expectancy, a best guesstimate that their primary care physician can give with regard to a 6-month life expectancy.
When transitioning to a higher level of care, please let us know in the comment box if you would like quality or quantity of life for your loved one.
So palliative care also provides so much support. And that's why the earlier that people sign up their loved one, the better it is for everybody in the family. Understand that when somebody is dealing with a serious illness at home, the entire family is dealing with that serious illness. And so, you know, focusing on everyone's well-being is very important when it comes to providing support. So definitely palliative care will provide patient support, family counseling. There may be times where we send in a volunteer to help so that the caregiver can get some rest. And also, once somebody is at the highest level of care on hospice care, all of their medical equipment is included as well. It's a very, very robust program when somebody transitions to hospice care.
Lonnie, can you share with me your personal story of when your loved one transitioned to a higher level of care?
So it was really interesting. My dad had congestive heart failure, and all he asked was he wanted to pass at home. So we said, okay, that's a piece of cake. You know, you're already home and it'll be fine. Anyway, one evening, he couldn't breathe. He went to the hospital on the ambulance. By the time we got there, he already passed. And so that was a huge disappointment for our family. Years later, when my mom was diagnosed with lung cancer, we found out that her doctor said to us, your mom can have hospice care at home. Well, at that time, we had no idea what hospice care was. And so once he shared with us, we thought, oh my goodness, this is really quite a comprehensive program that my mom would really benefit from. But I knew deep down inside that my mom wouldn't be about it. But anyway, this is how the conversation went, is when I went to see her and I said, Mom, guess what? You can get hospice care at home. And she goes, hospice? Oh my gosh, I can't believe you even said that word to me. I don't need hospice. I am gonna live for years. I don't need that. I'm like, oh, okay. All right. So I hear you. You're not about hospice as well. Well, Mom, I heard that we can get free stuff. She's like, free stuff? Like what? And then when I explained to her about the hospital bed, the oxygen, other things, of course, that she wasn't even using yet. She was currently using a wheelchair off and on, and my brother was renting that wheelchair for her. And so I said, so Mom, if I check and I find out that we can get all this stuff and, your medications are included and all that, I mean, do you want me to sign up? She's like, well, I mean, I guess sign up, because it's so silly. We're going to lose all that money. We can save brother from spending that money. So it would be great if we could save. So go ahead and sign up. So I do. And that was the beginning of a long love affair with hospice, for sure, because once they came in and their team was just so loving and compassionate, and they really gave my mom such wonderful, wonderful care. She went well past her 6 months. And then she said to me, oh my goodness, look at this wonderful care that I'm getting. I know, I'm so sad that Daddy, he didn't get any of this. And I said, yeah, you know what, Mom, we didn't know. We didn't know about this hospice care, how much they can come and really make you comfortable, and that you don't have to suffer and all of this. This is really wonderful. She says, yeah, I agree. You know what? I bet you all the neighbors have no idea about this hospice care. I want you to go out and go tell the neighbors. You go tell them right now, because I don't want them to lose out like Daddy did. I said, well, actually, I think that's a really nice idea, Mom, but it's kind of awkward, for me to go and ask them or let them know about something when maybe it's not the right time for them. Oh, okay. All right, she says. That makes a lot of sense. Well, you promised me now, you'll figure out how to go out there and tell everybody about this hospice. They cannot go and end their life without having this wonderful care. And I'm so glad I got it. And I wish that Daddy did too. And I hope nobody misses out like he did.
Thank you so much, Lonnie, for sharing that wonderful story. Please send Lonnie some hearts for sharing that.
So our support team, it actually takes an entire team for us to provide this wonderful service. So for palliative care, for those who are dealing with serious illness, palliative care will have a nurse practitioner. They'll have a registered nurse, a social worker, and also what's really wonderful is every now and then a person will come, a trained volunteer if that's needed, or possibly even a spiritual counselor if that's needed as well. And so that's for palliative care. Once things progress and a higher level of care is needed with hospice care, the entire team is on deck for the patient and the family. And again, I tell you, I was so happy to have signed my mother up for hospice care, because our entire family got the emotional support, the educational support, for us to give her medication. I mean, so many things were wrapped in that wonderful, wonderful gift called hospice that we had no idea about. And it's an entire team that comes. So here on this map, the colored areas are where we provide that service. So we travel from Lapahoihoi all the way to Ka'u, and we provide services for everybody within that too. So again, the key is to sign up as early as you possibly can.
Please type yes in the comment or chat box if you would like access to this expansive support team.
And a lot of people will say to me, I mean, my mother was one of them. She said, oh, I doubt if we could ever afford all of those services. And once I explained to her that hospice care at home is 100% covered under Medicare, she could not believe it. In fact, she thought it was some kind of gimmick or something. But once we signed up, she was just so very grateful that it was that easy. It was really that easy. And the VA covers it, Kaiser, all the major insurances cover it. So yes, in order to get hospice care at home, it is covered by most insurances. And for palliative care, for those who are doing palliative care that's early upstream, where they are not doing hospice care, normally their co-pays are covered under their insurance as well. Maybe if they have Medicare and Medicaid, or maybe they have Medicare and HMSA, that will cover their copay as well. And then again, the copay is anywhere between $12 to $40 whenever the nurse practitioner or the licensed social worker comes to visit for palliative care as well.
Right, raise your hand if you understand how palliative care is paid for.
So here's our mission. And this is really what all our work is all about, is improving the lives of everybody we touch. And by doing so, we do it through compassionate care of mind, body, and spirit. And that is actually our gift to ourselves as we do this very grueling yet heartwarming work that we perform every day. And it's because we really do love our community. And like I said, I don't do this because it's a job. I really do it because I promised my mom that I would.
Wonderful. Thank you, Lonnie, so much for your explanation of why palliative care can help. I'd like to thank everybody who engaged with us during her presentation. I hope you all have learned something new today. Just a friendly reminder, if you do have any questions for our presenters, feel free to put it right in the Q&A box down below. I do see that there were hearts sent to Lonnie for her story, so I thank you so much. All right, moving right along on this beautiful Thursday morning, we will switch gears to hear from our third guest speaker, Dr. Scott Miscovich, the founder and president of Premier Medical Group. Aloha, Dr. Miscovich.
Aloha, can you hear me okay?
Yes, I can. Wonderful. Thank you so much for joining us. I know you logged on early. I appreciate you sitting with us through these presentations.
No problems. I was still working, so I was listening. I couldn't answer the quizzes though. They wouldn't let me.
No problem. Again, just thank you so much for joining us and multitasking as well. Can you please tell us how you started Premier Medical Group and when you opened your Hilo practice?
Oh boy, it goes way back. I mean, I've been living in Hawaii since 1988. I mean, if you would look at Premier Medical Group, I mean, Premier Medical Group has really been my practice where I actually changed the name. But if you really look, the practices that all make up Premier have been in existence since about 2002 to 2003. And it was under my own name. And then as I kept expanding and growing, I wanted to make sure it didn't just become me. It became this large group of really terrific medical providers that all came together to offer premier services to our state. And that's how we came up to call it Premier Medical Group, because, you know, we have had plenty of awards and things that we're always going to focus on quality and the patients we serve. So about 2002, 2003.
Wow, wonderful. Thank you so much for sharing that background and history. Last month, we had Dr. Akiona on from your Hilo practice who joined us. She shared a lot about her street medicine and the challenges in providing care for the homeless. How do you see that situation improving?
Ooh, oh. Would you say improving in the way of delivering the care or just how we treat the homeless?
I would say in improving as expanding or being able to treat more people. Do you have any ideas on how that might? Uh,
It is so challenging right now, because obviously the state and the world has been focused on the pandemic, and we're going to be waking up here now and realizing that homelessness has expanded even beyond where it was from when we started the pandemic, and the concept of the street medicine, I think, is so important because so many of these individuals will not go into standard medical facilities to seek care. And part of street medicine is, and it's part of healthcare as a whole, just like we heard about, Hawai'i Care and choices. It's developing relationships, it's developing trusted relationships. And that group, especially since there's such a high prevalence of both mental illness and addiction, that you need to develop trust. And it's a great way to start by treating the people in the street. Now, where are we going to go? One of the things that the Big Island has been, and Hilo has been piloting, is community paramedicine and street medicine. And it's where we actually take the paramedics that get specialized training, and they can actually then be an arm of the medical community, delivering that care into the community and delivering it in the field. Then what you also do is you can focus coordinate with emergency rooms, where you have these people who frequently will use EMS, and they'll be homeless and they'll be really filling up the emergency rooms. And also we'll have non-homeless people that will have to go in all the time, but it's really not emergent. And that's when you want to take the community paramedicine trained individuals to start making outreach into the home, into the location where these individuals work or live. So that's really one of the processes that we're working on, and it is definitely going to be needed.
Wonderful, wonderful. It's great to hear that. What is your forecast of, this idea of living with COVID? I know Mayor Roth has stated that he would like to try to have Merry Monarch in April at regular crowd levels. How do you think it would be with the safety protocols moving forward as far as social distancing, masking, vaccinated, versus not? How is that? How do you see that moving forward?
Well, first, I think you have to understand what is the best projection of where we're going to go. We are seeing a decline, although, today, as you saw, you have higher numbers with deaths. We are going to see a significant number of deaths still in our state because the deaths are lagging, which is very concerning. And I think it's understated, and it's not focused on how many people are losing their lives associated with COVID and how many are actually preventable. And so moving forward, though, we are over the Omicron peak. I believe as an overall pandemic, we are more than just passing the midway of the pandemic. Now, I'm very concerned that political leadership is almost like declaring it a victory right now. And most of us who have developed or devoted our lives to this will basically tell you there will be more variants. That's a definite. There will be more variants. Now, how serious will they be? How much death will they cause? What will they do to our hospitals? Most of us believe we're past the peak. Omicron was the peak. So every new surge will be less and less. Now, what we do not know is, what if we get a true mutation that makes the vaccine much, much less effective? If that occurs, now we're kind of starting over again. So then the other issue we're not talking about enough in the public is that we are going to be having waning immunity from the vaccinations. That's just natural. We've seen it. So 6 months after you've had your vaccination, you will likely see less immunity. So we'll likely have more shots that will be offered coming up in the future. So I bring all of that up because you have to have those in perspective before you can answer the question, what will we be looking at? Now, if I look at Mary Monarch and give you my best estimation, I do believe we'll have quite low numbers by then. I would still recommend masking be used, even though Mary Monarch is kind of an indoor-outdoor environment with the facility where it's held. Will it be safe to have full attendance? I believe so. But I would say with masking, I would be happy with it.
All right, that's so great to get your insight on that. Also in relations to COVID, and we mentioned testing earlier, and there was a audience member who asked about the positive or negative testing. If I could just pull it up one quick second, we'll just go back explaining the false positives and the false negatives that happen with the test. I know Ali and Michele said you might be the best to kind of explain that a little bit further.
Okay, first we'll start at the bigger level. You have two types of tests primarily. One is the antigen test, which is what you're getting sent from the federal government and which you can get for free in some cases or buy over the counter. The other is the PCR test. They both are they're very different. Let's talk about the antigen test. The antigen test, it really does vary based on the quality of the test. We have a lot of manufacturers that have jumped in. It's up to about 50 who have received EUA, yet there's probably about 5 who are really, really long-term, solid, well-manufactured tests. A lot of them are just jumping into the market. So if the antigen tests then have approvals for 3 levels. Number 1 is only if you're symptomatic. Number 2 is symptomatic and you do the test every other day. Number 3 is asymptomatic. Now, this is really important that I bring this up because this is where there's such poor communication, both at every level about this type of testing as these are being sent home. And people were like, oh, great, a test, I use it. Well, no, they're not all the same. And you have to know how to use it. So the majority of those tests, which are like eye health that are coming to you, are only really good if you're symptomatic. If you get a test that is negative and you are asymptomatic, you could actually be positive. The other thing is those tests are no more valid than for a maximum of 24 hours. So if you get a test today, by tomorrow morning at this point, you could be fulminantly shedding and that test is not accurate enough to pick it up. So those are the very important points. As Ali and Michele did say, symptomatic is the best place they're used. Now there are a few tests, BD, Quidel, I think CareStart, and FlowFlex, that Bionex, that can be used for asymptomatic screening because they have gone through rigorous testing. But even then, they're about 90%. So antigen tests are going to be varying, maybe about 80% accurate, 75, 80% accurate, those home tests and the ones you're buying over the counter. Now switch over to the tests that Ali and Michele are doing. And I want to give a shout out to them. I'm so glad you had them on. They are just the cream of the crop. I've worked closely with Ali and Michele, and just, you heard the amazing story of Clinical Laboratories. What a great facility. What a great story about what has become our preeminent lab for quality in the state of Hawaii. If you want quality, you go to Clinical Laboratories. And the service that you get and the ability, I think it's such an underknown statement that you can get a PCR test on the Big Island and have been able to, even during the pandemic, and you get a response in 24 hours. Unlike those other, it's 4 days. They're turning it over in 24 hours, which is what we need as doctors to tell you as a patient that you're positive. You don't need to wait. Now, PCR, very, very, very little false positivity on a PCR, and also very little false negativity. So you're going to get, with the type of PCR and the machines that they're using at clinical, about 99% accuracy on both sides of the house. Now, one of the things I will tell people, this is a big miscommunication that also people don't know. PCR is so sensitive that the residual molecules that remain, that are no longer active in shedding, will still be picked up. So once people get a positive PCR, we don't recommend another PCR for about 90 days because it will keep showing this residual low positivity even though you're not shedding. So that's an important part. But PCR false positives, false negatives are very, very, very unlikely. Antigens much, much, much higher. And there's plenty of studies that show that. They both have their own effectiveness for use though, and both are effective if they're used correctly.
Okay, wonderful. Thank you for all of that information and kind of clarifying that as well for our audience. Thank you so much. Lonnie, I'd like to ask you if you had any questions for Dr. Miscovich. Oh, so sorry, you're on mute.
Oh yes, sorry. It's all my dogs and roosters. You know, we got to try to keep them at bay. Anyway, hi doctor. Thank you so much for joining us. Thank you. And so I wanted to ask in regard to boosters. So, you know, Maui County, they lifted their booster mandate recently, and Safe Travels is no longer going to require a booster as well. So can you tell me what kind of message is that, you know, putting out to the community, particularly because we'll probably still need boosters going forward?
That's a great question, Lonnie. And hopefully you all have probably seen me way too much. And I like to be just honest, you know, just as a doctor honest. So the answer to your question, it's the wrong message. So that's the only way I can describe it. There have been a lot of studies that have been done across the world that have talked about what is the best incentive for getting people, whether to get primarily vaccinated or now to get boosters. And we all saw them. Lotteries, giving out cash, and, you know, giving awards, giving gift cards and things like that. Yeah, minor. You know, the only thing that worked is basically tying in the shot and the booster to privileges like accessing restaurants. In Europe, it was pubs and bars. In France, it was cafes. That was number one across the board. And as Mayor Victorino said in his little press conference he had, or as he had like a town hall, actually they saw a nice surge when they made that announcement. They saw a nice surge. It is something that will it will get people to get boosted. Now, this goes back to a bigger issue. I said in the prior question, one of the things we're not talking about is waning immunity. So right now, if you're talking, we've had what, about 500,000 boosters given. The people that are the people with 2 shots right now, if you're at 6 months after your 2 shots, you're sitting at about 10 to 20% effectiveness in your immunity. Do our leaders say that to you enough? I mean, as a doctor, it's my responsibility to look at you and say, hey, like, you know, you only have a 20% chance that you're being saved by that boost, that those 2 shots you got 6 months ago. You need to get another shot to get you up to full immunity. And the studies are crystal clear, even with Omicron, which was, you know, a very different variant. It takes up to 90 to 94% effectiveness. So it really is important. And who knows what it's going to look like 6 months from now for those people who've only had 2 shots. They may have very little to no immunity if they had to have the disease.
So are they pulling back on the boosters because they are looking at the hospitalizations going down? I mean, what is the theory on it?
I think, to be blunt, it's because it's election year. It's an election year, so everybody is trying to do what's politically correct instead of medically correct, right? And it's election year across our country, and so unfortunately, that's not following the medical science whatsoever. And you know, most of us would look and say that purely using hospitalizations as a benchmark for making decisions a popular thing in the medical community. And I think you can talk about the coming up on 100 or 1,300 citizens of our state who have lost family members and children and grandparents, and they would have a little bit of a different opinion on that. So every life is valuable to me and to all of us, and could be preventable.
Yeah. Yeah, that makes a lot of sense. Can you share with us your recommendation on getting all school age children vaccinated? What's your thought about that?
Well, that is going to be a tough one.
Yeah.
I'm getting asked this all the time because we really are on the doorstep of having the younger kids, the 8 to 5-year-olds vaccinated, which will even be more challenging. As per the school age, actually, it's interesting. I'm on CNN all the time, and they've asked me these types of questions, and we talked about this at a worldwide level and a nationwide level. The vaccination uptick in the 5 to 11s is not that great. Even in other countries and across the United States, it's really not that significant. And and it does parallel, to be very honest, the seriousness of the COVID in that age group is quite low. And there's, obviously not a significant death rate in that. So will we end up getting to a point where it becomes a mandatory school vaccination? At some point in the future, depending on how COVID changes over the next 2 years, perhaps. But there is not political will, and there is not legislative will, and there certainly has not been the ability of our judicial branch to make that happen. I mean, all of the attempts to have mandates have failed. And so from my perspective, and especially as children, I really do feel the parents should have the ability to make a decision based on what their children should do. And as a doctor, what I look at the parents and say, even from the 6 months old to the 6 years to 12-year, et cetera, I say, listen, if you're on the fence, let me first tell you this. If your child has any health conditions whatsoever, whether they have asthma, they have lung conditions, whether they have a lot of extra weight, which we know is a big factor, or they've on certain medicines, please get them vaccinated, because they are the ones at risk. If your child is terrific and very healthy, they're on the fence. Do I recommend it? Yes, but are those kids going to have less chance they're going to have serious disease? Yes. So that would be my general answer. Anybody with any serious risk child, please, please, please get it. And then ultimately, let's face it, this is going to flow into the courts to make the decision be made finally. And there's going to be massive battles and probably more trucks that are going to be blocking everybody like they are in Canada.
Yeah.
So
yeah, that seems really almost ridiculous what's going on. But in any case, can you tell me about the mask mandates? Because there's talk about them pulling them from the schools at some point in the future. What is your thought about that?
Lonnie, let me put this in perspective. We had how many cases today? Like 1,107 deaths. And, like yesterday we were celebrating, we had 500. Well, let's go back about 2 months ago or 2.5 months ago.
Mm-hmm.
If we had 500 cases, there would be alarm bells going off. If we had 1,100 cases, that, everybody, this would have been the lead topic on every news channel. So we become so complacent with those types of numbers when I need to throw a number out to everybody at this point. We still have a mortality rate of about 0.5%. And so that means that as of today's numbers, there will be 5 residents of our state who will not survive COVID. That's serious. This is still serious. So to be already talking about stopping indoor mask mandates, et cetera, it is just not face, it's sending the wrong message. That's what we've had. The wrong message has been sent from our CDC to our federal government, down to our states, down to our counties. And we've seen this, 4 surges, every single surge. You can go back and replay what all of the leadership have said. As soon as we just get over the top and the numbers start going down, everybody uses the word normal, and they start saying, take everything away. And then all of a sudden we have another surge that comes, and then we wait a month or two too long before we then start to reinstitute those things. So that is very concerning. So that's why at this stage, fortunately, if I have to look back at the governor, one thing he has done fine is he's maintained an indoor mask mandate. And I hope he maintains an indoor mask mandate, because that is a very effective measure. Translate that over to schools. Oh my God, yes, yes, and yes, because we have 3 feet distance separating our kids, and the kids are, if you look at other countries who have much better measurement of the school data, they're really spreading it in schools. The only reason we can't predict how much our kids are spreading it in schools is we just don't have good enough data analytics in our schools, and they just keep blaming it on outside spread. When, how do you do that when you're in a school for 8 hours and then there's 100 kids positive over a period of a week and they only report 5?
Wow.
Sorry.
Yeah.
So yes, mask mandate should stay through the school year.
Okay. Tish, do you want to do a little segue right here before I go on to the next question?
Yes, thank you so much, Lonnie. We do have about 10 minutes left in our presentation. Thank you so much, Dr. Miscovich. If you could please stay on with us real quick. I just wanted to jump over and let everybody know that I would like to put a quick survey up on the screen now. I'm going to go ahead and launch that. For those of you joining us on Zoom, there are 6 questions. If you could just please fill that out, all 6 questions, and click the submit button below. It is anonymous and it will not be shared. We would just love to get your feedback on our presentation today, because we do take a look at those and they allow us to gain a better understanding of how we can better serve our community with presentations like these in the future. For those of you on Facebook Live, you won't be able to see it, but please send your thumbs up and your hearts. Everyone's can register for our fully engaged Zoom presentation next month, March 10th at 10. So while they're going ahead and doing their survey, I would just like to ask one question to Dr. Miscovich from our attendees. And that goes back to the booster shots. How long should someone wait to get their boosters if you've had COVID?
The data basically shows that you're able to get your booster 1 day after your symptoms resolve. That's what the new data shows, right? Now, that's as soon as you could get it. Now, what medically is clinically the best time to get it? I would probably be waiting about 8 weeks to get it after. And the main reason is that once you have the disease, the amount of immunity you have is quite significant. We're getting, as time goes on, we're getting really, really solid studies that show what your residual immunity is. And it's very interesting because each variant that you've contracted will give you a little bit different immunity. And the longer the time has passed since your infection with the variant, it will also change your immunity. But you're at a very high level immediately after your disease. So the data is also very clear that someone who has had the disease and is boosted is the #1 best protected person in the world. The data is crystal clear. People who have had Delta or Omicron and have had 3 shots are almost off scale in their immunity. So a lot of people are thinking, well, I had the disease, I don't want to get it. No, there's plenty shows that it depends on when you had the disease, which disease you had, which variant you had, and on your own immune system, because your immune system could be different, but it's black and white, boosted and the disease. You could go to the Merry Monarch without a mask, in my mind, that's for sure.
Nice. That's good to know. Thank you so much.
Wow, that is great information, because a lot of times when people have COVID, they'll come and say, "Oh no, I don't need to get vaccinated now. I already have the antibodies." So I'm glad that you clarified that, because we want to give the correct information, because God knows there's so much misinformation, out there. I got another. Oh, were you just gonna say a comment on that, Doctor?
No, it's just that there is outstanding information that we have and it came out of Israel, the Israeli study that looked at over 1 million people. And some of the best data we get, so everybody understands, is Israel and the United Kingdom. They have such great health systems, they have great information systems. And so the analytics they are able to do, and the Israeli study was done in conjunction with Harvard. And essentially it took everything from you were never had the disease to you only had alpha, beta, delta, and then Omicron, and then it studied the length of time, and then it also broke it up further into your age, your sex, prior health conditions, and it did just a massive analytic of what your risk was. And then it took, you had 1 vaccination, 2 vaccinations, you had booster, and you can imagine now all the variables that this puts in, and it just really spelled out of how effective it was to have a booster or a shot and the infection versus none. So, and
Wow.
so the other final thing I'll say is, if you're out there and your family member or friends or someone has had nothing, they are at very significant risk. So if you're totally unvaccinated, that's why that was bothered us, that there was this myth of Omicron being mild. Well, the reason Omicron was mild is because there were so many variable amounts of immunity that was already present across the world. And yet, if you took Omicron in a person who had no contact with prior disease and had no vaccinations, they were just as likely, pretty much just as likely they were going to die. So,
wow. Thank you so much for that information. So I only have 2 last questions really quick. Can you tell us the 5 top brands of the antigen test that you recommend?
Yeah, I would say at this point, I would say we have a lot of experience. I was the medical director for the U.S. Olympics, for the Summer Olympics, and they could have chose everything, but they chose BD. That was Benton Dixon, and then Flowflex has rated very well with Omicron. The Bionax now is probably lower on the 5, but that will work very well. Quidel and CareStart. Those would be the biggies. Those are the ones too you're going to see that have the most use and the most data and have been around the longest. And that's what we want to see.
Okay, great. And I'm just going to switch gears on this last question. For us at Hawaii Care Choices, we deal with a lot of serious illness. And one of the questions that comes up quite a bit is, why in general do doctors not tell their patients how long they have to live?
Oh boy. Oh man, this is a Pandora's box, but this is something I have had a strong opinion on in my practicing career. Let me throw some data points out. Now, this data I will clarify is pre-Omicron, because I don't think we're getting a lot of this. And I think everybody needs to understand this. In Hawaii, we have 2 statistics that we are the worst. And everybody needs to think about this. We have more people dying in the hospital while still receiving active chemotherapy or radiation due to Medicare data than any state. And then the other thing is, we have more people having inpatient hospitalizations and more inpatient hospitalization days within their last 6 months of life than any other state. And see, that for me is wrong. And that's where a facility like yours and what you're talking about with palliative care or full hospice care is where we are not engaging our patients with this. This is something that this conversation needs to change. And I have had so many conversations with patients and so many conversations with colleagues. And, part of it, we may think that it is part of the cultural aspects of Hawaii where, people feel it's not right to be giving up as a matriarch or patriarch in a family setting. And then maybe it's because of the long-term ohana where people don't want to leave the home and be in that home setting. But I can tell you that the people need to understand that the best thing that someone could ever do, and I spend so much time explaining to my patients when I try to tell them about palliative care or hospice care, is that when you make that decision, you are actually making that decision for your family. They feel like they're going to hurt their family, and they're going to hurt their family by feeling like they're going to say, oh, you're giving up. And I come back and tell them, no, 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 no. What you don't understand right now is your family is suffering with you. And when you get involved with the facility, like your facility and quality palliative care, the people that dedicate their lives to working in these areas are people who know, who care, they have compassion, they know how to deal with end-of-life care, they know how to deal with providing comfort, they know how to deal with providing quality. And that's a special skill that becomes a stress on the family, because it gets hard as people progress through, palliative care, to be able to really know all the signals of what to do and when to do it. And so from my perspective, I said, listen, what you are going to do by making that decision is this is for your family, because they'll feel so much better seeing that you're well taken care of, and that your quality of life will go up and their quality of life will go up, knowing you're well taken care of. So you opened up something I've spent a long part of my career trying to change in the state of Hawaii, because if you were in our practice, I will have family meetings and family conferences just to explain. I have so many times it bothers me when I get people that feel like obliged to be getting futile chemotherapy, and that really is just going to make them sick, and their quality of life will go down. And I sit there and say, you need to really ask your oncologist if this is going to add one more day of quality of life to you. I said, most of the time it doesn't. And I hate to see people suffering in their last 6 months of life. So I could talk all day about this, because it's a very passionate thing, because when you've cared for someone as a doctor for so many years, and then they unfortunately come down with a cancer, and we feel like they're part of our family. You don't want to see them suffer. You want to see them have the best quality of life and spend it with the people around them that they love. So
thank you so much, Doctor. Your perspective, everything we asked you is so invaluable today, and you helped kind of clip off some of that misinformation that just goes around every day, all day. And so we really appreciate this time, and thank you so very much for answering all of these questions. Tish, is there anything else that we have for Dr. Miscovich?
No, I just like to say I second that with Lonnie. We are just honored to have you on for our talk story. I can see the passion that exudes, when we talk about palliative and hospice care. And I, again, just like to thank you for all of the rich and valuable information that you gave to us this morning. I know all of us are just trying to move forward and sort of live with COVID. And I know all of us are trying to protect ourselves, protect our loved ones, our children, and stay safe amongst this. Dr. Miscovich, I'd just like to ask if you want to say any last words or comments to our audience before we close.
Sure. I do want everybody to understand we will get through this. We will get to a point where this pandemic will be in our rearview mirror, right? We will get through this. And so, and we are past the point, I think, that if we really start broadening and getting better communication in our state and understanding of what options are out there, especially with the monoclonal antibody and the new oral medications. As those become more available, the risk will go down. And so I want people to realize there is a rainbow ahead of us, and we will get there. And the best thing you're going to do is to be vaccinated and share, especially with your at-risk family members, to please get vaccinated. That's the best thing you can do.
Wonderful, wonderful advice. Thank you so much again for your time. We were thrilled to have you on as our guest speaker. I hope you have a beautiful day. I want to say, oh, thank you so much. I want to say thank you for everyone who has joined us this morning on our healthcare talk story. A very special mahalo again to Dr. Miscovich, Ali, and Michele for their valued time and such helpful perspectives that were shared today. If you have any specific questions about you or your loved one's situation, please reach out to us. We have a very helpful team standing by that will be happy to answer your questions. Call us at 969-1733, or you can also email us at care@hawaiicarechoices.org, or ask your doctor if palliative care is right for you. Our hope is that you receive the right care at the right time.
Aloha, everyone.
Have a wonderful Friday Eve. Bye-bye.